Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. Each month, we select an article to feature as a press release with an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm really happy to be speaking with Dr. Harriet Okronipa, who is the corresponding author for the article titled Nutrition Perspectives and Attitudes Among Ghanaian Pregnant Adolescents and Adolescent Mothers. I'm really glad to have you with us today, Harriet. Can you tell us a little bit about yourself?
Hi, everyone. So my name is Harriet Okronipa. I'm currently an assistant professor in global nutrition and food insecurity at Oklahoma State University. Go Hawks! So my research focuses in the area of maternal and child and then adolescent nutrition. My lab focuses on investigating the multiple determinants and consequences of inadequate nutrition among underserved populations globally. So specifically, we are interested in examining how factors such as household food insecurity, the food environment, and diet quality interact to impact the nutrition well-being of women, adolescents, and children. So our goal is to leverage on the knowledge we acquire to design and implement and then evaluate community-based nutrition interventions that are not only feasible, but that are culturally appropriate and sustainable as well. So I'm glad to be on this podcast to talk about our exciting paper.
Wonderful. And we really are so glad to have you here talking about such an impressive and interesting paper. So with that being said, can you give us a little bit of an overview of what you did as well as some of the results?
Thank you, Lauren, for the question. I'm going to start to just by telling a little bit about why we conducted this study and why were we interested in the adolescent age group. So as we might all know, adolescence is a period of rapid growth and development, and adequate nutrition is definitely important for proper growth and development. Now, we also know it's an age where they're building their dietary habits. They're developing their dietary habits. And whatever habits they develop would lay the foundation for their future. Now, within this adolescent group, you even have a group that's more vulnerable. That's the pregnant adolescents and then adolescents who have had children. Now, this group have an even increased higher needs because of pregnancy and lactation. Globally, teenage pregnancy seem to be on the rise, and Ghana is no exception. Teenage pregnancy is prevalent in Ghana. And unfortunately, not a lot of studies have focused on this special group, and understanding the challenges, they face, the unique challenges they face, this group faces. So understanding these challenges is crucial to developing targeted interventions to improve maternal and child health among this group. So it's basically what motivated us to conduct this study. And there's not a lot of data for this age group. So having the opportunity to conduct this study sort of is going to provide us with data to add to the database globally. And this is just the first phase of 3 phases. So this is the beginning, gathering the information, and then we have 2 other phases, which I'll talk about later. So basically, like I said, this was part of a bigger study known as the Healthy Adolescents Nutrition in Ghana study. So we conducted this study in 2022, and this is just one of the many objectives we had. And so for this particular study, we conducted a focus group discussion among pregnant adolescents, girls, and then adolescent moms from about 9 communities within the Cape Coast municipality in the central region of Ghana. So we recruited participants into the study. There was an eligibility criteria. They were eligible to be part of the study if they were pregnant or if they were an adolescent between the ages of 12 to 19. And then 2, if they were 12 to 19, if they were pregnant or had a child less than 5 years old. So those were the eligibility criteria. So those who were eligible were recruited into the study. And then we invited them to a central place to sort of collect a lot of different nutrition outcome data. And as part of this study, we conducted a separate study focus group to understand what their perceptions regarding nutrition was. So this basically was what we did, and we found that overall our results sort of centered around 5 themes. Okay, 5 central themes emerged: health and well-being, infant nutrition, dietary habits, nutrition information sources, and social support. And I'll go into some of them a bit later.
All right, thanks very much, Harriet, for that. You've done an impressive amount of work, and in reading this paper, I was also quite impressed with the recruitment of so many adolescents to participate in this and the geographical spread of those participants. So thank you for your hard work in this. And you just mentioned that the study identified 5 central themes related to nutrition perspectives and attitudes. Were any of these themes surprising or concerning? And if so, why?
Yeah, thank you. That's another great question. So among the 5 themes, the poor dietary habits was particularly concerning to us. Quantitative data, which I don't think we have in this paper, show that only 56% met the recommended minimum dietary diversity, meaning that about 44% consumed diets from less than 5 of the 10 recommended food groups. And this is concerning because of the importance of quality diets, and especially for this age group, like they're pregnant and then they're also taking care of themselves and then their children. And economic hardships usually would push many of these young mothers to rely on affordable but less nutritious food options, including street foods. Many of them reported that it was more expensive to cook at home it was more expensive to cook at home than to just get out there and then buy something from the street. Many of them also skip meals, and this was really concerning. And it sort of underscores the need for effective nutrition education and livelihood support or income generation activities for this group to enable them make better food choices. In one of our other manuscripts, we found that food insecurity was also very high among this group. Yeah, so this was really concerning. Yeah.
I can see why that was. Thank you for that. And I'm actually going to ask you to elaborate a little bit more on another key finding in this work, which was around adolescent mothers report that exclusive breastfeeding for 6 months was impractical for them. Can you talk a little bit about the reasons behind this perception? And have you thought about any strategies for helping these young women to adhere to recommended infant feeding practices?
Okay, yeah, that was also another another very concerning finding. And I would say, I mean, I have 3 different reasons. At first, I would say it's probably due to lack of knowledge. These teenage girls are young girls, and they may not have adequate knowledge regarding what foods to eat themselves during pregnancy, how much more what to feed to their children. And then they may not have an idea what the recommended practice is. So then due to this, they do not sort of follow the recommendations they are given. So of course, when they're pregnant, they have the option to get nutrition information from the health centers, but not all of them would also attend, antenatal care. So this is a problem. And another reason is due to economic constraints. Often, some of these girls would have to go back to work, immediately, not long after giving birth. And because of that, it kind of makes it difficult for them to exclusively breastfeed their children. And because of the economic constraint, they also have to often rely on less nutritious foods, which may not support optimal breastfeeding practices. And then the last point I would like to also make is that, there will also report of lack of support system, and this could also have contributed to these perceptions. A lot of them, they again, the knowledge is not there. So if there's nobody there to support them to, okay, do it this way, this is what you have to do, or take care of their children. Tell them, okay, you can still go to work, but this is what you can do. You can express your breast milk and then we feed your child and all of that. So if all of that support is not there, it becomes difficult for them to exclusively breastfeed. And as a lot of them also reported that there's a lot of peer pressure, right? They rely on nutrition information a lot from their friends, from their elderly people in the community, from some of their family members. And one key thing, for some of the quotes, somebody said, "Oh, all of these people didn't explicitly breastfeed their children, and they're okay. So then, okay, I can do the same. They didn't think that breast milk was enough for the child." And it also could be because they themselves are not eating well, so the child is probably not getting all the nutrients. They might not feel they're in a good position to breastfeed the child. So in terms of strategies, I think that based on what we've learned, it's important. Nutrition education is super important. Sort of designing like education that's tailored to their specific needs, And then because they are adolescents, you want to utilize delivery methods that's engaging, not just go give them a lecture and then go do this, go do that. No, try to find interactive ways of giving that education. And then also providing economic support might be important, and you can do that in so many different ways. And working with the communities to do that is really important. And establishing peer support groups would also be beneficial. Additionally, I think because they relied a lot on families and community members for nutrition information, I think it would also be helpful to include that group, the community, all of these other key people in nutrition education programs, because then if they know the right way to do it, it's easy for them to support the young adolescent child or the young adolescent mother to breastfeed.
The study has highlighted an awful lot, certainly, and I'm quite sure, as you've already mentioned, so many points and strategies for intervening among this group. I know you said this is phase 1 of 3 phases.
Yes.
Can you talk a little bit about the next steps?
Yes. Okay. So this is phase 1, like I said. So for phase 2, because we found that food insecurity was high, we sort of went back, wanted to understand their experiences, right? Before we decide on like the interventions to implement. And also we sort of implemented this photo voice study. And basically, we give them a camera and then give them a prompt, to look at the barriers and facilitators to accessing food. And that was very eye-opening because we kind of like found out, what the barriers they face, the coping strategies that came up. And a lot of them aligned with this. Economic constraints was number one, lack of support, all of those came up. So based off that, and also during the phase 1, we also collected data on sort of had another focus group talking to these girls about what livelihood supports they would want. Because they are adolescents, it's easy to go in and say, okay, we're going to do this intervention. We want to have this implement this income generation activities, but you want to involve them, to give them a voice, right? To involve them in that decision. So they came up with a series of interventions. We wanted something that would be sustainable, something that was culturally feasible, something that they wanted. And of course, number one is something that's evidence-based, right? So we got that information. Currently, we're running phase 3, which is implementing that nutrition education and livelihood intervention. So that's what we are currently doing. That it's a cluster randomized trial. There's 3 groups. The first group gets just nutrition education. The second group gets nutrition education and a livelihood intervention. The livelihood intervention is like soap making. They wanted to learn how to make soap because once they learn it, they don't need you anymore. They can do that, and then make the soap and then sell it to get money. And then so that's the second group. And the third group, which is a control group, is sort of a delayed intervention group. So they don't get anything during the study. But at the end of the study, we also give them the soap skills and then the nutrition education materials because we didn't think it was fair to just let them not have anything. Yeah. So it's a 6-month intervention. We're currently around the 5th month, so getting ready for our inline data collection. So hopefully we get very helpful information that sort of informs policy. Ghana.
So you have got a lot ahead of you, and
Yes.
I'm really looking forward to reading more about this work and seeing the results. Harriet, thanks so much for spending this time with me. But before we end, is there anything else you'd like to mention?
Yeah, I want to also say, because in the beginning you were amazed with the numbers, how we're able to recruit these numbers. And I want to say that for work like this, it's really important to involve the community. You need to you have a good community engagement. So we spent a lot of time in the beginning doing that because one, the stigma around pregnancy, teenage pregnancy. So if you didn't do that, I mean, nobody would show up, right? Exactly. And so then we spent time with the community, met with the local leaders in Ghana. There's queen mothers, there's the chiefs. We met with all of these political leaders within the community, told them about the study. And what was amazing was each community sort of gave us a community guide, somebody who was from the community and knew all like these girls. And so for recruitment, they would go with us and then show us, try to help us recruit the mothers. Yeah. So it was basically like a snowball recruitment sampling. So then we find one person, the person directs us to the next person, and that was how we were able to recruit that large number. We recruited 400 over 400, pregnant adolescents and adolescent moms. Yeah. So it's sort of also sad because it just means that teenage pregnancy is high. So yeah,
Yes.
community engagement is crucial to recruitment success. So I also want to say thank you first to the study participants. Without them, we wouldn't have this. And we're hopefully through this, we can come up with policies that would help them. Yeah, so we want to thank the study participants. We want to thank the research team, the field workers we recruited them from the Department of Clinical Nutrition and Dietetics at the University of Cape Coast. We want to thank all of them. And we want to thank OSU for funding this study.
Right. Well, again, thank you very much for this wonderful summary of the work that you're doing. And to all of our listeners, remember you can read this article in full at www.jneb.org for free for the next 3 months.